This video is essentially about weight loss, but it involves a B12 vitamin. And you might not think that vitamins can help with weight loss. Well, let me go through this one and see if you can understand what the context of this video is all about. Well, first of all, what exactly is vitamin B12? And why do you need it? Well, it's a nutrient. It's found in your food. You need it to keep your nerve cells healthy and to keep your red blood cells at an optimum efficiency. It's also extremely important for proper digestion. In fact, our stomach acids grab the B12 from the food, mix it with something else in your system, which is essentially absorbed by the intestinal tract. If you have a vitamin B deficiency, or vitamin B12 deficiency, you're likely to feel tired. Now, is that the only reason you're tired? Maybe not. But you're likely to feel tired, maybe lightheaded, weak. If you have those symptoms, you should have your B12 tested, at least, to understand if you have a deficiency. I have a friend who has a lab that does that. And I'm saying this not because I want to send you to him or whatever, because I'm not going to do that. I'm just telling you that he has made a long time study about this one, and he has found that he has helped many people who found out that they had vitamin B12 deficiency by uncovering this problem. Well, other things that may be caused by vitamin B12 deficiency is you may have a sore tongue or your gums may bleed. A lot of times they'll talk about some other source for gum bleeding, and that may be true. But you probably experience digestion problems, maybe diarrhea or constipation. You may feel tingling in your hands, your feet, or you get out of breath easily. You may even hear ringing in your ears, have chest pains, develop some other neurological symptoms, such as maybe forgetting, lack of ability to focus, becoming easily confused. Now, all of these things are not truly caused by a vitamin B12 deficiency, but they could be, and that's the point here. Well, what about the weight loss, as I talked about to start this video? Most people do not suffer from vitamin B deficiency, but many do, because it's readily available in many foods, meats. But here's the point. Sometimes vegetarians or vegans do not get enough B12 in their diet, and they become deficient, and they have a disorder. And people will have chronic problems. Crohn's disease is one of them. Celiac disease is maybe another one. B12 anemia, because of their inability to absorb B12, may be the real problem. But there are dietitians, physicians, and other people in the weight loss industry who have known that B12 is an energy booster, and sometimes they may have a person take B12 and it's part of their diet, and it helps them lose weight. Perhaps because of their limited calorie intake, because of getting their B12 another way. Well, that doesn't mean that you should take B12 and you automatically lose weight. That's just one of the things that comes about by this one, and you need to find out where you stand on your B12 situation. But since B12 is a big energy provider, many healthcare professionals and lay people swear that dieters should follow a regimen for B12 deficiency. Diet therapy. Most weight loss clinics include B12 injections as part of their overall health weight loss plans. Now, that doesn't mean that you should jump out and go do that because you want to lose weight. It just means that here's another thought, that if you're an intelligent person and you try to evaluate situations, you should evaluate this one. Understand for yourself and determine for yourself. Well, as people get older, they may eat a lesser variety of foods. And sometimes that helps to create other kinds of deficiencies, B12 or others. So, B12 diet therapy is often seen as necessary for older folks as well. And even most doctors who treat patients with Alzheimer's recommend B12 as a general blood cell booster to help with cognitive abilities. No indication, no promise that it will help Alzheimer's. No indication that you should jump into it as a preventive measure. But many doctors are, in fact, starting to do that. Maybe your doctor will do that if you ask him. Well, because a vitamin B12 deficiency can often result in an inability to focus or concentrate, students may also benefit from being tested from B12 levels. My friend who does some studies has some students who have found that may be some of the cause of their inability to concentrate. So, vitamin B12 deficiency diet therapy has also been shown to reduce cravings. If you can eliminate or greatly reduce your diet for these foods that you know are not good for you, you're well on your way to overcoming food and weight loss difficulties. Vitamin B12 is a great source for energy and reduction of craving. It's been found over and over by a lot of people. Will it help you in these cases? We don't know that until you find out for yourself by doing some research or doctor doing some kind of a test. And it can be done very quickly with a blood test to determine what kinds of deficiencies you may have. In fact, you may not have a B12 deficiency at all, but because you did something about looking for it, you found something else that needed to be taken care of immediately. Hope you like this video. If you do, subscribe to it on YouTube. Thanks for watching.